Our next speaker was, I think, appropriately introduced earlier by Linda as Tinkerbell with boxing gloves and a brain. But I want to tell you a little bit more about Dr. Oliver than just that, because the brain part of it, I think, is critically important. You heard mentioned before of the Collegium Ramazzini, and Dr. Oliver is a fellow with the Collegium Ramazzini. She has testified before Congress, she has testified before OSHA, and she's constantly called upon as a medical expert for persons that are suffering from asbestos disease that are looking for some type of remuneration in that regard. Dr. Oliver, it's always a pleasure to work with you.
So what I would like to talk about is suppression of science and manipulation of public perception. And I realize that takes a certain amount of chutzpah, but I'm going to proceed anyway. Suppression of science creates doubt. It allows for the creation of false narratives. It can be and often is used to manipulate public perception. David Michaels in 2008 wrote about the tobacco industry. Doubt is their product. The same can be said for the asbestos industry, and unfortunately today the same can be said for the federal government of the United States. I'd like to give two examples that illustrate this problem with regard to asbestos. The first is chrysotile asbestos as a cause of malignant mesothelioma. The second is asbestos as a cause of malignant mesothelioma in females. So chrysotile causes malignant mesothelioma. We know this. That is not in doubt. But it was in doubt at one time. I remember at some point in my training, whether or not chrysotile caused asbestos was a controversial issue. And it was in doubt because of the amphibole hypothesis. It was in doubt because of the biopersistence or lack thereof of asbestos fibers in lung tissue. Also, epidemiology showed lower risk for malignant mesothelioma in chrysotile exposed workers compared to workers exposed to amphibole asbestos. So there were several factors that contributed to that. We know that doubt has been fueled by industry-sponsored science for a long time. I'd like to give an example that has to do with chrysotile asbestos and malignant mesothelioma. And it was an article that was published in 2006 by a man named C.M. Yarborough of Exponent. And he wrote an article in Critical Reviews of Medicine, and the article was entitled Chrysotile as a Cause of Malignant Mesothelioma, an assessment based on epidemiology. He stated in the article, there has been a long-standing debate about the potential contribution of chrysotile asbestos fibers to mesothelioma risk. Mind you, this article was published in 2006, and a lot of this so-called debate had been laid to rest by 2006, so it was disingenuous at best. Yarborough claimed to have used the scientific method in arriving at his conclusion that chrysotile is not a cause of malignant mesothelioma. He relied upon cohort studies, he failed to include case control studies, and he dismissed patient reports and case series. So let's take those backwards. Malignant mesothelioma is a rare disease. It was a rare disease then, it's a rare disease now. And for rare diseases, patient reports, case reports, and case series are like a red flag saying, here is something you need to pay attention to. He failed to include case control reports. Case control studies are the epidemiologic method of choice for rare diseases. Instead, he relied on cohort studies. Cohort studies are not the epidemiologic study of choice for rare diseases. Yarborough talked about the precautionary principle. The precautionary principle is a cornerstone of public health, and it basically says when you're dealing with the public health, you err on the side of caution. He stated of his review in 2006, this review suggests that the application of the precautionary principle is no longer supported by the cohort epidemiological data for chrysotile absent amphiboles and malignant mesothelioma. Now, OSHA in 1994, in its rulemaking on asbestos, it very clearly adopted the precautionary principle when it said that evidence presented to it refuting chrysotile as a cause of malignant mesothelioma was, quote, unpersuasive. And erring on the side of caution, OSHA basically regulated all 6 asbestos fiber types in the same manner. That was in 1994. And they adopted the precautionary principle. The second example I'd like to use is asbestos and malignant mesothelioma in females. And what I'm going to talk about now involves, in part, a review that was written by Xavier Bauer as the first author, but Arthur Frank and I both were co-authors on this paper. So in full disclosure, I had some involvement with that. So chapter 2 of the 5th edition of the World Health Organization Classification of Thoracic Tumors, one of the Blue Book series, is entitled Tumors of the Pleura and Pericardium. There was a statement in that chapter, quote, there is also variation in population attributable fractions of malignant mesothelioma by sex. In the USA and France, 80 to 90% of mesotheliomas in males are caused by asbestos, but only 20 to 40% of females. In 2021, Bauer et al. Published the results of a review of malignant mesothelioma in females compared to males. The review showed that if you take into account environmental exposure to asbestos, as well as occupational exposure to asbestos, there's really no difference in the occurrence of malignant mesothelioma in males and females, which we all know. We informed the authors of Chapter 2 of this Blue Book about our findings and asked them to correct the misinformation in their chapter. They refused to do so. So we went to the editors of the book, got no satisfaction, went to the editorial board chair of IARC. IARC publishes the Blue Book series. Getting no satisfaction there, we went to the director of IARC and requested a correction. We shared with them our findings and requested that they correct what was said in Chapter 2. We're still waiting for that correction. So these are 2 examples. How did this incorrect science in each case alter public perception of the truth? Well, in the first case, the takeaway would be, if you were a layperson reading the paper by Yarborough, that occupational exposure to chrysotile asbestos does not increase malignant mesothelioma, which of course is false. With the second example, the takeaway is the majority of cases of malignant mesothelioma in females are not caused by asbestos, which is also false. And it carries with it the potential for exposures and disease. So clearly, incorrect science here manipulated the public perception. Now there's a new kid on the block, and that is a presidential executive order that was signed by President Trump on May 23rd, 2025. The executive order is entitled Restoring Gold Standard Science. The purpose of the executive order is to restore America's faith in scientific enterprise and institutions. The executive order, I've read the executive order, it employs all the right words: transparency, reproducibility, unbiased peer review. It's to be implemented by federal government employees and agency heads. The suppression of science is not new, but in this case, the federal government, the perpetrator is an executive order by a president. Agency heads and unqualified civil servants will cut science to fit the will of the current administration. David Michaels and Wendy Wagner stated in The Atlantic in July, quote, "The result is a system, will be a system, in which science, rather than informing policy, is shaped to serve it." And that's exactly what is going to happen in my view, and I hope I'm wrong. The consequences are dire. So to protect against asbestos-related disease and to further prevention, we in this room, as a first step, must continue to do what we and what ADAO do best, which is outreach, education, surveillance, and advocacy. We need to be very vigilant and warn others about the science they are reading. They need to be, need to check it twice or 3 times or 4 times. In the past, the science comes from scientists with which we may disagree, but they're scientists nonetheless. It is not clear that that will be the case if this executive order is carried out and if it is implemented. But I just think it's something that has not been getting a lot of attention that I've seen. And it's, I find it pretty scary, but we've faced this kind of thing with asbestos before, and I'm sure we can face it again. Thank you.